Welcome everybody. My name is Philippe. I am the executive director here in Ottawa, in the unceded and traditional territories of the Algonquin Nation. And we are a large group today, and we appreciate you joining today. We are going to try to keep it to an hour so that there's no additional time taken away from your Saturday. We had hoped for immediate translation for in French. Unfortunately, that system doesn't seem to work today for some reason. Not sure what's happening. We tried every which way, and it's not, unfortunately, not working properly. So, without further ado, we will apologize and we will make sure that those folks who are joining us or francophones at least can read the slides. They're all bilingual and all completely translated. So the opportunity is hopefully you can stick around and still benefit from that a little bit. Wanted to again welcome everybody. The Houseless to House campaign that we launched about 6 months ago is an attempt to showcase how the society is a major. If I can just be good to be able to switch my slides. There it is. Is a major actor in the housing issue and fighting the housing poverty symptoms. And combined, the society makes a massive difference. The difference is that we are doing it locally and in a customized approach. Implies that whatever happens in one particular location will be different from what happens in others because we are there to answer to those in needs in ways that nobody else is doing it. So it's really an approach that's completely different and unusual. But combined, it's an important and a very impactful voice in Canadian society, in our communities. What we are going to talk about is three such activities and such initiatives, and we're going to go from center to west to east. We're going to start in Windsor, Ontario. Jennifer is going to be taking on the first portion of this presentation. In Windsor, she helps to run the Windsor Essex Street Outreach Team, and they basically go out in the streets and help those surviving and to survive homelessness. Elaine will then follow, and one of the Elaines, because there's two of them, but one of the Elaines will follow and then speak about how Kelowna, BC's Invincible Housing, her program there, it works on preventing homelessness and maintaining homefulness, I suppose, I guess we could say, by keeping people housed. And then finally, Ray will close out the presentation and we'll talk about how Halifax is addressing community living issues in their communities with a number of different approaches that are intended again to complete the package and support those neighbors in need in that community. So without further ado, one more thing then, if you have questions, please don't feel shy. Do ask it. Use the chat button on your menu and make sure that you get heard. We will allow about 10 minutes, if we are lucky, at the end of this presentation to answer the questions you have. So please proceed and ask questions as you see fit. But without further ado, let me pass on the mic to Jennifer. And Jennifer, talk about what happens in Windsor, please. You have to unmute yourself first.
Isn't that a genius concept to unmute myself? Really, girl. So good afternoon, good morning, my fellow Canadians. It's wonderful to see you all here this morning or today on a Saturday. The weather in Windsor is expecting a snowstorm in the next few hours, and it's quite overcast. I don't know where you're all at, but in Windsor, we're finally seeing what winter is. It's been a while. We didn't see much of it in December. Anyhow, if I can begin, I would get to the point. So our very beginning. So this fine fellow that you see here in the image, his name is Joe Olette. So Joe Olette began Agupe Crochet, which translates into unconditional love and prayer, in the winter of 2021, right after his wife passed. And so Joe initially went out on his own with $10 for handing to the folks on the streets that he saw so that they could get themselves a hot meal. That quickly escalated into his realization that women on the streets have suffered quite significant traumas, and he needed some women to be on his team. And so he onboarded two ladies, Margaret Maroon, who is still with our group, and she's actually one of our trainers, and a lady named Glenda Fisher, who's an Anglican minister. And so these two ladies, one would go out with Joe on Wednesday, and the other would go on Sunday, and out they went. By the spring, Joe realized that this was not a financially viable solution anymore, and he came to the St. Vincent de Paul asking if we could help support his mission. Street Outreach began and was born in May of 2022. From our very humble beginnings, we now number 50 volunteers that work with us on a regular basis, 18 of which are part of our Boots team. Now, we fondly refer to Boots on the Ground, or Boots as we call them in short, as our disbursement team. So they are our team that specifically go out into the field. We are the only fully mobile outreach group operating in the Essex County region. All of the other groups operate off of fixed site locations, or are there's one group now who's recently added a arm of their group to have some mobile outreach. So the training that Margaret and I provide is a specialized 2-hour safeguarding session. So quite a lot of the usual that you see with the society safeguarding, but we've added about an hour specialized for non-Vincentians as it dictates to the work that we do in dealing with the unhoused. And then we do a further 6 to 8 hours of field training. So in addition to that, how we recruit our volunteers is we do education and inform sessions. We pick up some donations, but mostly we're there to educate the public on what the unhoused situation looks like in our region and what we can do to improve it. And so we are constantly on the recruit because the numbers are just exploding down here. So behind the scenes, how do we get this done? I am very happy to brag on my people to say that we started in 2022 summer getting our cost of food down from $14 for a meal bag down to $4.75. We still are able to do $4.75 a bag through the donations that we have harvested from multiple locations. Our hygiene bags, we at this stage, because of the expense of them and the limited amount of donations, we really only do about 6 to 7 packing sessions a year. And that gives us about 100 hygiene bags that we disperse each week. And then the food bags during the summer, our food bags are somewhere in the range of about 2,400 calories. And we will go through in a week at least 125 to 150 without even blinking an eye. And some weeks this past summer, we were hitting the 200 a week mark. Now, all of the other items that we carry, being sleeping bags, shoes, footwear, other footwear, socks, underwear, clothing, these types of things, that is all donated to us through the society shops. As the shop goes through and reviews the clothing items and ascertains what is not suitable for being able to be sold, and in our case in Windsor, the voucher system is the same as what we offer in our retail stores. We do not differentiate between voucher clothing and saleable clothing, but those that are not saleable then become available to us at Street Outreach. So part of our food packing team includes up to a 6-year-old is where our youngest member is, and our oldest member is an 86-year-old. Now we have some high school students that come and participate with us. We have some CWL members, and we have some Knights of Columbus members, as well as recently the Young Adult Ministry of Windsor has become heavily involved. And where I identify, ideally, I'd like to see 6 to 8 people. They tend to show up with 22 to 24 every Saturday to pitch in and help out. So, woo-wee, they sure do take over my life. In 2022, we ended up sending out 2,400 meals and 700 pairs of socks. And Last year, it was 7,260 meals and 14,406 pairs of socks. So I don't know, but I'm assuming most of you through your career would have come across Maslow's hierarchical needs. So what is interesting in our training is we explain to all of our new recruits that in order to become a fully evolved and fully formed human being, you have to realize each level as you go through before and accomplish that before you can move up to the pinnacle. But what we have found, and Margaret, with her training that she used to do, while she was located in Las Vegas, was some of her clients would say to her, "We're not even on this chart." So we added a sub basement level for those suffering from addiction. Because when you're in the throes of addiction, you're not concerned about whether you have a bed or a house or where your food's coming from. You're working to address the needs of the addiction. So we have revamped how we handle the home visit here in Windsor and Essex County. And so our home visit is we are out, hip waders on, and out we go to the encampments, the back alley bushes. And yes, while the man sitting on the pavement is not our local area, the tent is one of our localized areas. So what do we do? Our goal is to find those that are lost and forgotten by the system and bring them back into the fold. So many just don't know where to turn or where to go. So, what's most important to us is making sure they know of the various systems that are in place, where they can find their social worker if they're not on the housing list, how to get registered on the housing list, how to apply for and receive Ontario Works benefits so that there is some income coming into them. So, what's most important for us is not just to address their physical hunger. We can solve that. We can solve the clothing issue and the footwear issue. But what's most important that we see time and time again is how many of our friends haven't talked to a human being in weeks, haven't had anybody look them in the eye and treat them as a human being with kindness. And that's why we do what we do. So at the very beginning, food was provided at the parish level. And so unhoused people would knock on the door and say, "Hey, I'm hungry." And now we have developed and evolved because our area is now seeing the crisis that hit Vancouver, that hit Toronto 10 years ago. That's where we're living at right now. And we are up 135% from last year, but 980% growth in the support that our group has offered just since 2022. I never wanted to see numbers like this ever in my life. I was hoping I could put this group to bed and close it down after a year or two, but the reality is that's not happening. So, what I would like to suggest to you is if you have the opportunity to watch the movie A Stone Pillow with Lucille Ball, very factually correct, very true to life. And if you get the chance, Ryan Dowd, he's a brilliant, brilliant trainer and speaker. He used to run a homeless shelter in Chicago. It's a free webinar. It is hands down some of the most articulate thoughts to convey of what we are all dealing with across the country. So thank you very much for your time.
Thank you, Jennifer. As always, very informative and very inspirational. I think what your team is doing is essential. Essentially, it's an essential service, and I think we can say that about every initiative from the Society of St. Vincent de Paul is, we don't do things that just for the fun of it. We do it because it's essential, and I think in your case, it's very clear, at least to me, and certainly to those folks I think who joined us today. So let's move on. Let's get out west in beautiful BC in the Okanagan Valley and talk about the Invincible Housing Program that Elaine created and runs. So please proceed, Elaine. Go ahead.
Good morning, good afternoon, everyone. I didn't start it, just to be clear. I'm a member, though. Some of the people in the picture were part of the very beginnings of it. It's about 10 years now we've had Invincible Housing. It's a special project of the particular council, and the aim is to end and prevent homelessness before it ever begins. So we work hard to do that, and what we determined through home visits that rent was often precarious, and why. You got laid off, your EI hasn't kicked in, or you didn't have enough hours to get EI, unexpected illness, and you're in a job that doesn't have benefits, you lose 2 or 3 days work, or your child loses 2 or 3 days of school and you have to stay home to be with them, or you're waiting for things a lot now. We're seeing a lot more people waiting for work permit renewals, and they just don't have enough money for rent. People aren't able to save on low incomes, so they kind of get stuck. So they end up not feeding themselves to pay rent. That's when then we would go bring a food hamper and determine this. And so we work hard to then work with them and determine how can we continue to address this need. So family phones are a conference. They determine rent is the ask. And so it's referred out to the Invincible team, and there's 9 volunteers now. And there's the stats there. The 121 not assisted doesn't need to be necessarily a negative. A lot of the times we don't end up assisting because other agencies or programs in BC are able to jump in and help, but they still end up on a not assisted. Sometimes we run out of funds, but usually a benefactor will drop a bag of money into our laps at the very last minute, and we'll have that last person that's on the list. We provide up to $450 once per year, and it's paid to landlords. So that's the piece in there. So as I said, it's once a year. They have to live in our area. Clearly, we get calls from all over the Okanagan areas outside of our catchment area, and we make referrals. That's the big thing, is that anything we can't do, we have a big network and we send them to other places. The first time that we contact the person and we talk, the very first question, are your taxes done? There's a lot of benefits that can be received, like GST, disability tax credits, dental, all kinds of things. And if they say, well, no, then right away we get them connected up. There's a lot of, here in BC, we have a lot of clinics now where we have Revenue Canada, Service Canada, and the Ministry of Poverty Reduction attending various sites, and all this stuff can get done quite quickly. We may ask for bank statements. We'll often ask for a lease agreement. And sometimes we'll speak to the landlords and ask what they're thinking. And especially then we speak with other organizations, because it usually takes multiple points of contact to make things work. So who are some of our partners? Well, we have partnerships with in BC, Canadian Mental Health, Now Canada, New Opportunities for Women, the Kelowna Friendship Society. They receive funds from the BC government for rent supplements. So a lot of times they need more than our 450. So we'll also contact them and say, you know, can we work together to get this? And then after we've taken the application, done all of that, spent a lot of time talking to the various partners, then we'll move along and write it up, and then we vote by email. And if we decide, then we make payment to the landlord, as I said, and usually by e-transfer. Or it can be a check, and then we enter it into our database. It's how we keep track. And if we can't help them, we do talk to them and let them know and explain why and what else they can do. A lot of things that are happening now in our area is everybody running out of funds, and so we all just have to really pull together. And I have to say that in the interior here, the pulling together is really, really good. And we all cross refer, they refer to us as well. And even the ministry in BC, if you're on income assistance, you can receive a crisis grant, and it's repayable. It's not a loan. But if they don't qualify because they've already had one or other reasons, like being a senior and you can't get income assistance, then they tell them to phone St. Vincent de Paul. And that's kind of a twist that government's sending people down to us. But we get the calls and we just proceed and work to see how we can do it. There's a lot of agencies we do work with, like Mamas for Mamas, which is a local organization spearheaded by a lady who is a mom, and they do tremendous work working with families on case by case, and also a lot of donations for families, formula, diapers, cribs, all those kind of things. Social workers and interior health, when they're doing their home visits, will often call and ask. There's an organization called Seniors Outreach, and they also do case management, and they have housing navigators. So we have someone who right now actually needs housing. They're 64, the building's going to be renovated. She's lived there 18 years and she's just in panic mode. But so we'll connect her, and sometimes we'll take them to the agencies or we'll make a phone call to introduce them. But we really do try our very best to ensure that things happen. It's really amazing sometimes when we've completed the whole process and we're able to help them and phone them and say, we've got $450 for you and your rent's paid and you don't have to worry. And there's tears and laughter and virtual hugging and all those kinds of things, because people just are so stressed, worrying about, oh my gosh, what am I going to do? What's going to happen if I can't pay my rent? And so we work hard on that. And it's a very gratifying ministry, very challenging, takes a lot of time, but we would encourage anyone across the country who would like to start such a thing. Please stay in touch, contact us. We're more than happy to work with you and help you identify other groups in your areas. Here in BC, we also have, it's called SAFER, Shelter for Aid for Elderly Renters. We'll help them with their applications. Refugees who are so new that they're not yet even at the point of being in any kind of a system. They've just arrived. Lots of kids, sometimes they don't get child tax benefit. We help them navigate as much as we can, or we refer. There's an agency here who does a lot of work with that. And the other group is people who are unhoused. And these would be people that Jennifer might, if she lived here in Kelowna, might phone us and say, I've got Joe who's unhoused. He's ready to jump up the hierarchy. And we found him a place to live. We don't have enough money for the deposit, pet deposit, etc. And we would jump in and start working with that and seeing who between us and the others I've mentioned could help. So, and that is just so exciting when that person gets into their housing and they suddenly have a key and they have might be small, might be a little 250 square foot apartment or a tiny home, but it's theirs. And then the ongoing support. So if you want to start, we would suggest that you have a team of at least 5 or 6, because there is a lot to learn and a lot of brainstorming, and support for one another. Research who's doing what in your community. If there's already somebody doing this, ask if you can be a partner. Develop your guidelines, fundraise, and let your conferences, if it's a council that's doing this, let them know that you're open for business and accepting referrals. And so please contact us if you're interested and would like to do this. And let us say as an ending that may every person in Canada have safe, secure, and affordable housing, a place to put their head on a pillow tonight. Thank you for listening.
Thank you, Elaine. That's from your mouth to God's ear. It's exactly what we're all about and what we hope to accomplish. And hopefully, invincible housing will not be needed eventually. That would be the ideal situation.
Yeah.
And
So,
excuse me, I have a question. It's Helen Clow from Prince Edward Island.
Helen, if you don't mind, we would like to complete all three. I guess you joined in a little later. We
Okay,
are going to take all the questions at the end of the presentation. So if you don't mind,
okay, sure.
either keep it for then or write it in the chat box. It would be very appreciated. Thank you so much. We're just trying to get everybody through, make sure that everybody gets the opportunity to talk. So through the magic of Zoom and storytelling, let me pass you on to the Halifax shores or the shores of Nova Scotia in Halifax with Ray. Ray, please take it away. Speak to us about Halifax.
Great. Thanks, Philippe, and greetings, everybody, from sunny Halifax today. To all Vicentians that have joined in, it's great to have you folks attending. I'm the third leg of the stool here on the presentation today, so I'll try and go through this as speedily as I can. I want to share with you some of the services and resources that we provide here at the Halifax Particular Council, and some of and that really means some of the community living services and solutions that we're providing. This isn't to say that, of course, we want to overshadow or imply other great things aren't being done across the country. They certainly are, but just gives you an idea of what's happening here. So basically, there are three special works here at the Halifax Particular Council. One is Hope Cottage, which is our food kitchen, soup kitchen providing meals in the area. Our second is Hand in Hand, which is our local thrift store. And the third is housing. And we're involved both in temporary and soon to be permanent housing. So just a little bit of background about the Halifax Particular Council. If you're not aware, we have 16 conferences currently. 12 of those are within the metro area of Halifax, and 4 are in outlying areas. In 2023, we worked with or assisted 4,000 households, and to the tune of about $1.34 million in assistance. That included rent, food, utilities, et cetera, as you can see from the slide and some of the stats there in front of you. I'd also like to mention that we do have 4 conferences that are involved in twinning, which I think is very important, and also we're involved in twinning at the council level. We do partner with other organizations and associations. One of those, for example, is the local food bank and shelter. It's called Beacon House, and we're part of the leadership team there. And I would be remiss if I didn't mention that some of the 16 conferences as well partner with organizations in their local communities in order to accomplish what we feel we need to do as Vicentians. Another new organization we're associating with is the Nova Scotia Nonprofit Housing Association. That just was formed last year, so it's a work in progress, but we're pleased to be associated with other nonprofits that are interested in doing something about housing in the province. I'd also like to mention that we have hired a new executive director. This is a brand new initiative for us as of November 2024. And he'll basically be in charge of creating awareness, promotion, and increasing funding for the conferences here involved in the Halifax Particular Council. So we currently have about 310 volunteers, and of course, that's growing. And we're happy to have as many folks as we can get involved. The first thing that I wanted to talk to you about with regards to community living solutions that I alluded to is Hope Cottage. And you can see from the graphic there, it's quite an interesting building. The original structure was in the 1800s, and Hope Cottage was actually founded in 1950, 70 years ago. by Father Joe Mills. And the Archdiocese owns the building, but we have operated it, the society has operated it since its inception in 1950. We have a good, productive relationship with the Archdiocese in providing food and a soup kitchen. And of course, it's located very close to the downtown core, so it provides easy access for the folks that utilize this service. We were initially we were the first soup kitchen that ever opened in Halifax, as far as we're aware. So we've seen quite a bit of change and structure in that time period. And because of that, we are a bit of an icon, and so it's great for volunteers, that type of thing, because many people do want to help and serve. Prior to COVID, we were serving about 200 meals a day. That's since decreased. We're not quite back up to that level. And now there's more options in the city than there used to be. So that's part of the reason. But with regards to Hope Cottage, they are open Monday through Friday, holidays, and they do serve a Christmas meal. We are very blessed to have an organization called the Friends of Hope Cottage, and they've been assisting with fundraising for a number of years. Referring to the slide, in 2024, they raised $156,600, and that was primarily through two events that they have. One is a golf tournament in the summer, and one is an early Christmas dinner in October. So that's critical to the operations of Hope Cottage, that fundraising. As well, I'd like to note that we have a young, new, motivated executive director. Further to that, we've just formed a new board for Hope Cottage that came into effect in September of 2024. And we have an awesome chair on the board and several talented members. So we're really excited about having that asset with us. Currently, there are 5 staff at Hope Cottage, along with the executive director and a number of volunteers. The board now, one of their first tasks will be to explore additional resources and services that can be provided in the community and also with the space that's available at Hope Cottage. And there is a possibility of perhaps considering a mobile meal service to spread the reach of Hope Cottage a little bit further for those folks that are unable to go there. The second community living solution is our thrift store, which is Hand in Hand, and it's located in one of the low-income areas of the city in Spryfield. That's been open since 1990. The Halifax Particular Council owns the land and the building for the thrift store. And I want to point out that it's a real community initiative. They support 17 local organizations, and the merchandise within the store is varied, but it focuses primarily on clothing with some household goods, not a lot in the way of furniture. Year-over-year sales have been increasing, especially since coming out of COVID, which of course did a number on our thrift store, as it did, in many other areas of the country. In 2023, sales were 433,000. That increased a little bit this past year to 436,000 in 2024. There's currently 19 staff, 14 of them being part-time and 5 full-time, and that's supplemented with a number of volunteers. It's important to note that they do provide work placement for a number of folks in the area. And so the job placement and volunteer opportunities is a real benefit to the community that they're situated in, and that really expands the impact that Hand in Hand has. Recently, they acquired a C-can, and we were very fortunate. This provides extra storage for the donations that are coming in. And this was provided by MSC, which is a shipping company. And through contacts, it was shipped down from Montreal, and the value of the sea can was $18,800. So it's currently on site and being utilized. It was much needed. I also want to point out that the value of the donated goods to the was about $24,000, and also that Hand in Hand has contributed well in excess of $100,000 to the operations of the Halifax Particular Council to fund us and all the services and resources that we provide. Their goals going forward this year in 2025 for Hand in Hand will be to still try to improve a bit more community awareness. There's lots of competition out there. So promotion of their location and the store itself, and also maximizing the interior space they have to best merchandise the product that they have. The third community living solution we have has to do with housing, and there's two components here. One is temporary and one is permanent. The temporary one, as we can see from the slide, is the tiny emergency shelters. This is sort of a one-person solution. This initiative was actually started at my parish, St. Ignatius in Bedford, 4 years ago. The Archdiocese liked the idea, so they have since taken it and run with it and done a fantastic job. Throughout various parishes in the Archdiocese, there are now 25 of these temporary tiny emergency shelters. Each one, as you can sort of see from the graphic there, is about 8 by 8 feet, and they're built 2x4 construction. They have a built-in bed. They're drywalled. They're storage. The floor is PVC water permeable as well. They come with heat, air conditioning, CO2 and fire alarms, and they do have electrical for cell only. Various teams in the parish or teams within the parish work with the individuals that are currently housed in these temporary shelters. And there is a coordinator that the Archdiocese has hired and has been operating and working with the teams in the 25 tiny shelters. So their duties include intake, outtake, vetting the people that are going to be living in them, moving the shelters if necessary, setting them up, and the Archdiocese actually covers all those costs. The approximate cost, these are manufactured locally by a company called Well Engineering, is about $11,500 to $12,000. That's probably gone up a bit, but if you're interested in individually helping folks that are homeless, this is a great start. The second and last component of our community living solutions is our permanent housing project. And we are building a permanent supportive house apartment building on Brunswick Street in Halifax called Ozanam Place. And we're very pleased to have been able to do this. It's based on a housing first model, which means that the belief is that people need to have permanent housing before many other issues can be addressed, such as employment, mental health issues, addiction issues. So this was actually started. We broke ground in October of 2023. The Halifax Particular Council has a 25-year commitment to be involved with the project. As far as finances go, the project will cost $17.5 million. 2.2 of that is actually donated from the Halifax Particular Council. That was the value of the land that the building is situated on. And we're fortunate in that it's right beside Hope Cottage. So folks that are living at Ozanam Place will have an opportunity either to cook their own meals or to just walk out the door and walk in the next door and have the meals they're serving at Hope Cottage. There will be 38 private living units. 33 of them are studio. 5 of them are 1 bedroom. So the square footage varies from 370 to about 500 square feet. All of them will have their own private baths, kitchens. They'll be able to control their heat, their air. They all have windows and private entrances, et cetera, et cetera. There's common kitchen, meeting rooms, and lounge. And of course, there's laundry facilities, private storage for them, even a steam room. It's important to note that the rent charged will be deeply affordable, and it'll be a maximum of 30% of whatever the gross income is of the individual. So if they're on income assistance making $600 a month, then their rent would be capped at $200 a month. They'll be signing leases, and that's
Just
the way
listening to
that
this
will
thing
work.
about homelessness. It's almost done.
Yes, and it'll open May 1st of this year. That's the tentative scheduled date for opening.
Remember we saw on TV about
Brenda,
Nova
can you-
Scotia and the little
Brenda?
houses?
Brenda, can you please mute yourself?
Yes.
Thank you.
Thanks, Brenda. Appreciate it. And just a few other things we wanted to point out about Ozanam Place is that 25% of the units will be accessible. There is an elevator. All tenants will come from the Halifax by name list. Philippe, we need to move on. We're sort of stopped at this slide. So there you go. Great. Thank you. And the demographic being targeted is 50 plus, because we felt that this was an underserved demographic within the folks that are homeless. And so again, the folks that will be selected to occupy or live in these units are from the by name list, and currently it's around 1,200 in Halifax right now. That's just in Metro Halifax. So another thing we're really proud of with regards to the building is that part of the design included trauma-informed design, and we believe we're the first in Nova Scotia that is involved in affordable supporting housing that have utilized this. And what it simply means is that the design techniques have been built in so that the tenants can adapt and adjust more successfully from being homeless to being housed. That has, it's a major transition for folks. Some of them are suffering from what would be akin to PTSD from living either in shelters or in tents. So it's things like soundproofing, it's things like open sight lines, communal meeting spaces, et cetera, et cetera. So we're very proud to offer that. The actual management and the daily operations of the building won't be through the Society of St. Vincent de Paul, although we've started the initiative and we'll actually be the owners of the building. We don't have any expertise in this, so it's the North End Community Health Center who will be operating it, and they do have a lot of expertise. They will have 24/7 staff, they'll have a nurse, they'll provide the resources, and because of the age demographic, we're looking at even potential hospice care. So we're just thrilled that we're going to be able to provide this permanent solution to housing in the near future coming up in Halifax. So just in closing, I wanted to relate that the three initiatives that we've presented today, including the Windsor-Essex Street Outreach and the Invincible Housing in Kelowna and our community living solutions, are just three of many things that are happening across the country. So I think the lesson in this is not to underestimate what the Society of St. Vincent de Paul is capable of and the contributions we make in fulfilling our mission and values right across the country. As our founder so eloquently said, do not be afraid of new beginnings. Be creative, be inventive. You who have the energy, who have enthusiasm, who want to do something of value for the future, launch out. Do not wait. So hopefully we've provided some incentives and some motivation and some insight and information as to what's being done and what can be done across the country. And if you have any questions, We have our website from Halifax there, as well as Hope Cottage. So I guess at this point, we start to take questions, and thanks very much.
Thank you so much, Ray. Very, very exciting. We can't wait to see the building in May when it opens, and speak to the people who will be living there. We will be definitely recording that for future reference and for communication internally and externally to make sure that people understand all that we do, not just in Halifax, but everywhere else. So without further ado, let's move on to the chat room. And Alice, I think you were taking,
Yes, good afternoon.
do you have, can you relay
Yes,
the questions?
so I do have a couple of questions that came into the chat. The first question, well, it was not really a question, it was more an information. Michelle Dafunga would like to have from Jennifer the documentary name and the name of the speaker that you mentioned.
Okay.
So that's actually on the PowerPoint, which Philippe, I believe we're going to be providing that to the attendees that will follow. So she'll be able to retrieve that information shortly. But to repeat, the movie is A Stone Pillow, and the speaker was Ryan Dowd, D-O-W-D.
Thank you very much, Jennifer. And Hélène Clow would like to know when the question is for invincible housing, do you help with utility bills, electricity, phone to prevent disconnection?
Utilities are still handled by each individual conference. There has been a big increase in requests, so that could be potentially another special project. But right now, invincible housing is only rent.
Thank you very much, Hélène. The
I-
next question is for Ray.
Hang on.
Yes, go ahead, Philip.
Linda also asked Jennifer to provide the feedback of the trainer that you referred to, and it skips my mind. Can you please remind me?
The Ryan Dowd training?
Ryan Dowd, thank you. That's the answer to Belinda.
And the next question was for Ray. Where are the tiny emergency shelters located? Are they on parish property or public property?
Great question. Yeah, I guess I didn't communicate that effectively. The program is coordinated through the Archdiocese, and they are all located under this particular program. They're all located on parish land, and there are teams within the parish, often through the Society of St. Vincent de Paul, that again liaison with the occupants, meet with them on a weekly basis, maybe providing meals, other things that folks that are living in the tiny emergency shelters may need. There are other organizations that have picked up on this and do provide tiny emergency shelters, but this specifically is a program coordinated through the Archdiocese, located at parishes.
Thank you very much, Ray. Stephanie would like to know, and this is from all three presenters, if she would like you to address what are your top priorities when it comes to advocating to the government or policymakers and at any level. And for example, she gave an example to improve income support, raise minimum wage, fund, or prioritize affordable housing.
So let me take a first stab at it. So on the National Council, we have a social justice committee, and one of the subcommittees is called advocacy. Their current objective is working on basic income. We're partnering with a lot of organizations across Canada, Basic Income Canada, learning a lot about the pilot project in PEI and the federal government, and with upcoming elections, preparing materials to look at and advocate for a national, not a universal income, but a basic income that would tie in with provincial programs. So that's what we're doing. And if anyone's interested in joining that committee, we would love to have you. So please, you can contact us through the various ways to contact. And Ray and I will be more than happy. It has 2 co-chairs, both in Ontario, and they would be thrilled. We'll also be, one of the members of that committee is preparing parish bulletins, which will be being circulated quite soon. So if you see them, please pass it on and have it, your parish, put it into their bulletin. Communication's the key to all of this, so.
Thank you very much, Elaine. Ray, there is another question for you in regards of where are the funds coming from for the projects?
Sure. Well, specifically, I guess the question would be for Ozanam Place, and that was through the Rapid Housing Initiative, which was through the federal government and administered by CMHC. So of the 15.5 million that we needed funding for, remember, we contributed to 2 million, 2.5 million, the society in and of itself for the land. The remaining funding needed, 11.2 of that came through the Rapid Housing Initiative. It's still happening. You apply for grants. We were well in front of that, though, because we had already had architectural plans drawn up. We had a construction company that we had been communicating with. So when the application for the funding came out, we had all our ducks in a row. The remaining funding needed, 3.6 million, will be provided by the Nova Scotia provincial government, which totals the total, which accounts for the total building cost of about 15.5 million. So that's where the funding came from. And as well, I should account, it's not cheap, and I did mention this, I think, in my presentation. The ongoing operations, of course, it won't be cheap to run this. There'll be about $750,000 a year to operate the building and pay for the folks that are involved in the North End Community Health Center. Everything from snow removal to garbage to staffing, social workers, nurses. And the provincial government has committed to funding that. As a matter of fact, we're just signing the agreement for the 3.6 million in the next couple of days. So we're fortunate. But the thing is that, you know, there's interest from the governments because they're no longer interested in operating this type of housing themselves. So when nonprofits get involved, there's a willingness to fund them because then once the funding is completed, the government's able to say, well, you know, you're operating it, it's your responsibility. We funded it, but now you, the ball's in your court and you take it and run with it. So they're not hiring anybody. They're not, it's not government run in any way. And this is the way it's going now, I think, for this type of supportive, deeply affordable housing. Hope that answered your question.
Thank you, Ray. Just being mindful of the time, we have only one last question, and the question comes from Jose Torres, who would like to know, for major projects, what do you consider your major challenge? And that the question is for all presenters.
Okay, well, for me here in Kelowna, continuously seeking funding, volunteers, and seeing how it just, the needs keep increasing and increasing, working on other factors such as basic income that will alleviate some of the stressors in the system. So that's my answer.
And for me, is fundraising, fundraising, fundraising. Our central council covers about 30% of our budget, and the rest of it is raised through community initiatives, from conferences, passing up some funds, and from writing grants. It's just nonstop. Find the funds to cover the cost for everything. The team keeps finding new needs and new people, and I got to find a way to finance it.
Yeah, I would echo that as well. We're trying to put things in place, i.e., as I spoke to before, with the new position we've created for an executive director. One of his main tasks will be fundraising. That's for all conferences in the Halifax Particular Council, because that will allow us to do the work we need to do in the community. And we know as Vicentians that the demand is only increasing. And that's why we sort of have to look at this with a two-pronged approach, meaning that we need to provide charity, and we do that very well on a day-to-day basis, but we also need to focus more on systemic social justice issues, which will hopefully, and there was a question sort of going in that vein before, hopefully address more systemic problems so that we're not just going around and around and around in circles, that government can provide a more meaningful role. And they will only do that when they're pressured, as far as increasing minimum wage, as far as basic income, as far as income assistance levels.
All right, thanks very much, everybody, for joining today. I apologize if you haven't got all your answers answered. Brenda, I didn't see anything written from you, but I will be sending all participants and all those folks who couldn't join us today a link to this presentation, as well as all the email addresses that were inside the presentation. I've seen a few requests for direct contact. You will be able to get access to all the presenters today directly from the email we'll send you within the next week. Again, I wish you a great rest of your weekend, and we thank you so very much for your engagement and for your interest in this program and these programs. These are just a few of them, and we intend to continue to shine the light on all the great work that that the society does across the country. So again, appreciate your interest and your insight. Thank you for all the presenters, for all your work and all you do. We're very, very deeply thankful for all your work you do. So have a great day, everybody. And again, thanks for everybody. Bye-bye.
Bye.